Good afternoon. It is a great pleasure for me to be here with you and expressing the enthusiasm of EULAR in the collaboration with the National Society in Europe. It is my great pleasure now to share some slides on this collaboration and to show you that EULAR has an intense activities together with the national societies. And EULAR, it is the association that represents the different organizations of people with rheumatic and musculoskeletal diseases in Europe, the health professional organizations, and the scientific societies of rheumatology of all European nations. Thus, the three pillars of EULAR are represented by the organizations representing the HPR associations, the patients' organizations, and the scientific societies. The mission of EULAR is to reduce the impact of rheumatic and musculoskeletal diseases on the individual and the society, but also to improve the position and the quality of life for people with rheumatic and musculoskeletal diseases. And we have different initiatives that we promote and stimulate to support this activity. What we can say is that EULAR, although it is a European organization, it really represents rheumatology at global level, showing excellence and performing excellence in different areas. EULAR members are the corporate members, the scientific societies for rheumatology, the associations and organizations of people with rheumatic and musculoskeletal diseases, and health professionals. And these are the different nations that represent EULAR in different countries. EULAR governance is composed by the General Assembly, that is the highest authority of EULAR, and which is composed of the members of EULAR. But it is governed by a board which is composed by 4 experts in rheumatology and 1 representative of each pillar, including the representative of the scientific societies, that is the vice president for the scientific societies. In the board, the vice president represents the EULAR in general and also has a relevant role, speaking also on behalf of the scientific societies. What is of note is that in the last years, EULAR has clearly developed the concept of the EULAR family, that is a team of people who work all together in different areas based on a concept of inclusion, equity, geographic distribution, and meritocracy. So any individual who wants to work with EULAR and want to contribute to EULAR activities at each national level and international level can participate in our work. We have developed our strategy and we have developed different activities, and the presidents of the member societies, including the scientific societies, have always a relevant role in this work. We also have important partnership with other organizations from other continents, which strengthen our association. Our activities were focused on different areas. And in particular, we work on education in order to foster professional and patients' education. We develop tailored material and courses. We have different offerings which cover both the virtual and online offerings, but also live meetings, different contents and different courses and different publications and many free learning materials. We also developed in the last years the EULAR Research Center, which is the vehicle of EULAR research in Europe. This has the aim of serving as the focal point for rheumatology research in Europe. And the mission and vision of the research center is to catalyze the collaborative research in Europe, provide a roadmap for research in our continent, but also develop broad coalitions and partnerships. And essentially, the EULAR research represents a stimulation and a consolidation to the foundation of research and the capacity of research in Europe. EULAR advocacy works very actively to engage with the EU at national and international level in order to improve research funding, social policy, legislation, and quality of care. The EULAR Advocacy Committee works in direct contact with the EU institutions and agencies, but also with the medical societies which represent the other associations and organizations in Europe. The last activities of EULAR advocacy are represented by the EULAR Manifesto, the EU outreach on different areas, the brochures on comorbidities and RMD diseases. We are working on the World Arthritis Day, and we have a very solid collaboration with EMI and with the Biomedical Alliance. Quality of Care is a very active committee working for improving and implementing standards of care for people with rheumatic diseases. We have different products that are developed, including recommendations, point to considers, classifications and diagnostic criteria, and they also are offered as lay summaries for patients. The EULAR Congress is for sure the most important congress worldwide in the field of rheumatology. And the Congress, until 2 years in 2000, was a Congress that was organized every 4 years, and we had the smaller symposia in between the big congresses. From 2000, the Congress is the most is organized every year in one of the biggest, the major cities in Europe, and it represents a very important forum and platform for exchange of scientific and clinical information in Europe. In 2023, the EULAR Congress was organized in Milano, in Italy, and we had more than 12,000 participants on site and more than 4,000 participants that participated in the on-demand platform for a global of more than 16,000 persons who attended our offerings. We have different communities that work in EULAR with very important networks. They are represented by the network of the young rheumatologists, which are called EMINET, the health professionals, the pediatric group, and the patients group. The strategy of EULAR is developed every 5 years, and in the current 5 years, we work and we developed our activities based on the principles and the areas that I just described. And particularly in this period, we also worked on the next strategy, which will start in 2024 for the next 5 years. This will represent the bridge into the future, and when we imagine a world in which all rheumatic and musculoskeletal diseases are recognized, diagnosed, and ultimately prevented or cured. We have developed our values that guide us for the next 5 years. So in the modern age, EULAR is a global organization which works closely with the national scientific organizations, the national societies for people with rheumatic diseases and health professionals, and all the 3 pillars work all together with the aim of improving the lives of people with rheumatic and musculoskeletal diseases, so those who are affected can have a normal life or at least a better quality of life. And thank you very much, and I wish you a really excellent Congress, and I'm sure that the program, you will enjoy this program. Thank you so much.